Recently, there is a news stating that there is a possibility of using the AI in the primary health care delivery. AI in the primary health care delivery. So, in this article, the columnist tries to explain the what are the potential implications, what are the challenges in adopting the AI in the primary healthcare delivery. So, what are the he addresses the fundamental issues in the fundamental issues whether AI can be adopted in the primary healthcare delivery. So, he addresses the issues such as he first he first says that A is impersonal. So he doesn't care who the person is, who the patient is. So it views patients as a passive recipients rather than the active recipients. A views patients as passive rather than active recipients. And another issue is, see, it AI lacks the characteristics of a human intelligence. See, what is the important aspect of human intelligence is he understands the real world. Based upon the real world scenarios, he tries to take the decisions, but it cannot be performed by the AI. And he also says that, see, in medicine, retrieving the complex information and processing it and reasoning it and planning are very fundamental in the treatment of a disease, but these cannot be done in the AI, he is stating. So, and he also says that AI is mainly meant for the repetitive tasks and the automative tasks. So, but whereas the whereas the primary the primary healthcare is much more than that. It requires a complex process of information and taking the decisions, right? So what does he says? See, treatment of disease requires an human centric approach. See, we need to talk to the patient, then we need to keep them comfortable, then we need to treat them, we need to understand their pain, and we need to empathize with them. But these things cannot be with the AI. So, and one more thing, AI cannot replicate the moral and the ethical reasoning. The most important aspect is AI cannot have the moral or ethical reasoning. He also says that he also says few technical issues with the implementation of the AI as well. So what does he say? He takes example of an reproductive system. He takes example of an of one. He takes example. What is the example? He takes Nagel's rule. He takes he takes Nagel's rule. So it is from obstetrics, which has been used in the from the past 200 years. It is based upon the reproductive it is based upon the reproductive habits of the European women. So it accuracy is only for 4%, right? So if you want to improve the percentage, if you want to increase the accuracy, we need to have a lot of we need to do a lot of research. We need to have access to personal data and all these things. So he's saying that so that it cannot be, but personal data related to the patient, right? So if personal data is with the patient, so how can AI can access the personal data? It is an invasion of the privacy rate. He is mentioning the issue of the invasion of the privacy as well. So and he is also stating that. So he also stating that what are the economic costs involved in the adoption of the AI as well. So if you wanted to train an AI model, does it requires a lot of investment for the collection of the data. For the collection of data also we need to set up an infrastructure. So he is addressing all these issues, and he is also saying that few more issues. So AI in AI decision making in AI decision making is not transparent, and it is not easily understood. It is stating that issue as black box problem. And further, he is also stating that, and he is coming back again to Nagelli's rule. See, Nagelli's rule, it is based upon the reproductive rates, right? So the reproductive rates of the people or population changes over a period of time. If you wanted to have the accuracy, again and again we need to perform these repetitive tasks, and it involves the huge amount of cost also. And further, what he is saying is, and further he's saying that there can be, so if you come to India, he is he from he when we come to India, he's saying that there is if for training of the AI models, we there might be a chance of the exploitation of the vulnerable population also. So how, see how it will be like, they'll be taking the personal data of this vulnerable population without the consent. Further, for culturally and demographical diverse country like India, collection of data is a much more an issue. And we also don't have a act like European Indian Union Artificial Intelligence Act. We don't have a act like European Union Artificial Intelligence Act also. So all these issues he is trying to say with the AI in the primary healthcare. But he is also saying that where AI can be used in the healthcare. He is saying that AI can be used in the specified, well-defined specified tasks such as optimization of the drug delivery, and further large language models can be used in the mimicking of the patients. So these, in these places this AI can be used. And finally he concludes state that India cannot leapfrog into AI driven healthcare without first addressing the foundational issues in the health system. For example, India spends less than 3% or less than 5% in the on the health, 5% GDP on the health.